This was a controversial bill. It was LD 1333, and it basically deregulated Maine's insurance market. And it is now known as Public Law 90. And what the proponents of the law basically promised was that if they were allowed to deregulate the market, and the proponents are the new Republican majority in the legislature, they said, if we allow the free market to take over Maine's insurance laws, which that doesn't mean that we haven't had free market competition in Maine, it's just their perception. But if we deregulate the market, get rid of these consumer protections, raise the rates on some, lower the rates on others, that we promise that that overall premiums will go down for everyone. Why? Because there will be an influx of young, healthy, uninsured people into the Maine market. That was the promise.
Spreading the costs around.
Exactly.
Yep.
And this really sort of follows on the theory of insurance, that the more people you get into the insured pool, that you spread the risks and the costs more broadly, and therefore the rates should come down. However, the rates did not go down. In fact, the rates for the majority of individuals purchasing, for example, the largest individual policy in Maine, Anthem's individual policies, went up for 54% of those policyholders. In particular, it went up for the older people who are buying, and we know that Maine is the oldest state, has the oldest median age in the nation. It has the most rural, we are the most rural state in the nation, and that under this law, the rates went up the highest for the oldest people, and in particular for those living in rural areas. For small businesses, 90% of small businesses who renewed their, got their renewal quotes for the first 2 quarters saw their rates go up. And I know that the Maine Center has done some good analysis of by how much. And what the biggest impact was. But this was across the state, whether you're in the northern part of the state, the southern part of the state, even in the south, 85% of small businesses saw their rates go up. And so the promise of young, healthy people flooding into the market, lowering rates for all of us, just did not happen. And I will also say it will not happen.